On the Health Watch, ignoring your doctor's advice. Local researchers say some people just stop taking their generic drugs.
And technology, is it causing rashes? Dr. Mallika Marshall joins us with details.
Oh my goodness, I have so many things to tell you about tonight. First of all, iPads may be giving people rashes. A report in the journal Pediatrics says the iPad may contain nickel, a metal that many people are allergic to. In fact, an 11-year-old in San Diego had to go to the hospital for a nickel-related rash. Now, researchers say doctors should think about electronic devices when treating a patient for skin rashes. I'm going to have to keep that in mind. All right, brand name drugs and generic drugs are equally effective, but they can have different shapes, colors, and sizes. Now, local researchers wanted to know if a change in the appearance of pills could cause people to stop taking their medications. Turns out, it can.
If I was taking it for years and I was used to its appearance and I hadn't been warned that it was changing, I would probably be a little concerned.
This is a very commonly used blood pressure medication, and this is the exact same strength and type of pill.
Dr. Aaron Kesselheim, an internist and health policy expert at Brigham and Women's Hospital, studied thousands of people after a heart attack and found that when patients received a generic drug that differed in shape or color from their previous one, they were about 30% more likely to stop filling it. Dr. Kesselheim says people rely heavily on the shape and color of pills to remember what they're for and when they should take them.
You know, I take the blue one in the morning and I take the pink one in the evening.
So if the appearance of the pills suddenly changes,
especially if a patient is elderly or has vision difficulties, that can be very jarring to the patient, and so it can lead them to be confused.
Pills sometimes look different because a pharmacy changes suppliers or the supplier changes pill cutting machines. But Dr. Kesselheim says doctors and pharmacists should explain that to their patients. Some pharmacies are adding labels warning patients that their medication appearance may change, but not a lot of people read these labels. Virginia Patrick just picked up her prescriptions and got a verbal alert from her pharmacist.
She said your Depakote pill is changed a little bit in color, and that's why it looks a little different, but it's okay.
That's right, it's okay. Now remember, just because your pills may look different, they are still going to be equally effective. The FDA has really strict standards when it comes to generic drugs, but if you're worried that you may have been given the wrong medication or you have other concerns, the first thing you should do is call your pharmacist so you don't miss a dose. All right, also, using a regular kitchen spoon to give your children medicine may do more harm than good. A new study in Pediatrics shows that parents who pour medicines onto spoons are 50% more likely to give the wrong dose. Now, oral syringes, droppers, or the measuring cups that come with children's medication are much more accurate. So, you know, everybody talks about giving a teaspoon, and so here's a typical teaspoon, and it's just not an accurate way to measure. So instead, if you've got kids, you use a syringe, you use a cup, or you can actually buy these medicine spoons. So if you want to use a spoon, you can use one that will accurately measure out the dose.
Don't ever drink from the bottle.
No, you don't want to give your child a swig of medicine, no.
But really, could the FDA make this easier too?
They actually have. The infant Tylenol used to come in a different concentration, so now at least it's consistent with the children's Tylenol. So they're making changes, but there's still some confusion out there. So
good to know.
That's why we hire you, Dr. Mal. Thank you. Send your story ideas to Dr. Mallika.